அதெல்லாம் எனக்கு ஒண்ணும் பண்ணல. எல்லாம் நல்லா இருக்கு.
வாமிட்டு
நான் இதெல்லாம் ஹெல்த் விஷயத்துல நான் பக்கா பாத்துக்குவேன். ஒண்ணும் இந்த மாதிரி நெக்லெக்ட் கிடையாது.
Do you have the courage to make 8 lakhs a month, which is 1 crore a year?
Good evening, all. Hope I'm audible. Hello. Good evening. Am I audible?
Good evening, sir. Yes, sir, you are audible.
Thank you. I heartily welcome you all for Disciples India Learning Forum. So let us experience the joy of learning. Hi, I'm Shiv Prasad. I'll be your host for the day. So request you to kindly mute your phones. Possibly you can sit in a place where you're not disturbed. Request to ask questions at the end of the session. Remember, a new learning is always difficult initially, but becomes a habit eventually. Today's agenda: welcome and introduction, journey so far of Disciples India Learning Forum, guest speakers introduction, and the session. Disciples India Group. Disciples India Group Bangalore is happy to present a platform purely for the joy of learning. It is envisaged to be an exciting learning platform where like minded individuals and organizations can come together, share experiences, and learn as individuals, professionals, and organizations. So, these are our objectives: to provide a platform to share and exchange ideas and experiences, to create and develop personal and professional network of learners, to enhance effective communication and leadership skills. Disciples India Learning Forum organizing committee members of 2023 are Dr. A.M. Suresh, Forum Advisor, Dr. B. Rupashri Tantri, President, Mr. Shivaprasad K.M., Vice President, Mrs. Madhumati L., Secretary, Mrs. Veeraja R., Joint Secretary, Mr. Akhilesh N.N., Assistant Secretary, and Mr. Dilip A.P., Executive Member. Disciples India Learning Forum. As of now, we have completed 124 learning sessions from last 5 years. So some of the sessions this year we conducted on employment market and career opportunities by Srimati Sadhana Epote KS. On Republic Day, 74th Republic Day, we had guest speaker Colonel Gopal Krishna Kaushik. And 105th learning session we had on nutrition and lifestyle. We had on memory management. We had on psychological insight. We had importance of accreditation and ranking of institutions. At the time of elections, we had responsibilities of voters, habit of savings and investment. We had a topic on chat GPT, wellness program. We had a tie-up with IELTS, that is IDP IELTS by Mr. Zulkar. We had a program on achieving happiness. We had a program on pain assessment. On 116th, we had an offline session on happiness reloaded. 117 program we had on a topic of Indian heritage and modern management. We had on investment planning, three secrets for sustained success. 120th program we had on impact of CSR in government higher education. So 121st we had on importance of results and success in life. 122nd it was analysis of heart sound using AI techniques to detect heart diseases. So 123rd we had on soft skills and non-verbal communication. And the last session was on national digital health mission. And coming to today's session. So this session is in association with Aganasha Consulting LLP, which is in Elanka, Bangalore. So this will be our 125th online learning session. So guest speaker of the day is Dr. Pramata Dikshit. The topic is cervical cancer awareness. Now I request Ms. Misbah to introduce our guest. Over to you, Misbah.
Um, Sir, am I audible?
Yes, Misbah, you are audible.
Yeah.
Yes.
Good evening and a very warm welcome to our 125th online learning session on cervical cancer awareness to one and all present here. It is an honor to extend a warm welcome to our esteemed guest, that is Dr. Pramata Dixit, who has just finished her MBBS and is currently working as a house surgeon in Dr. B.R. Ambedkar Medical College and Hospital. She has always been academically driven, securing state third rank in the SSLC examination, scoring distinctions in all of her MBBS years, and also being the topper of a college in the final year MBBS examination. She has also published a paper in the field of orthopedics in the Indian Journal of Orthopedics. In addition to academics, she has also been learning Carnatic music from 15 years and has secured state third rank in the Carnatic Classical Senior Examination. She has actively taken part in numerous prestigious music competitions and has won many awards. Her passion in the field of medicine has led her to actively participate in the Rotaract and in the Medical Association. We welcome you, ma'am. So, without any further delay, let's give us a virtual round of applause to welcome Dr. Pramata Dixit. We are excited to have you today, and I'm sure we are in here for an insightful session. Dr. Pramata Dixit, ma'am, the digital stage is yours.
Thank you so much for the introduction. I thank Disciples India Learning Forum today for giving me this opportunity to share with you some important matters about cervical cancer and how we all should be aware about it. So I'll start my presentation now. You can see my screen, right? Can you hear me?
Yes, ma'am, we can see your screen.
Okay, thank you. Okay, so cervical cancer has been a topic of discussion from the recent couple of years because of how fatal it has been and how people are less aware of what is going on about cervical cancer and who is at risk or like who acquires it and many other things. So today I would like to share at least some important superficial facts about what every one of us should know about cervical cancer. The global incidence of cervical cancer, Asia ranks the highest, and India is also the second, stands second in among the Asian countries for having the highest number of cases of cervical cancer. Cervical cancer is the third most common cancer in the females worldwide, and second most common cancer in India. So first most common cancer in India is the cancer of breast, and second stands cervical cancer. And the most common cancer of female genital tract is again the cervical cancer. So every year in India, around more than 1 lakh women are diagnosed with cervical cancer, and around half of them die from the disease. So we've been talking about cervical cancer. So what exactly is the cervix? So where is it located? So I'll just give you a gist of what exactly the cervix is. So this is the uterus and it's the female reproductive organ, and that is where the basically in layman terms we call it as the womb, the mother's womb, right? So the cervix is the junction between the uterus and the vagina. So the vagina is the external genitalia of the woman. So cervix is exactly at the junction between the uterus and the vagina. So basically, every organ in our body is lined by a layer of cells. In the same way, cervix is lined by a layer of cells. So it has two types of cells. One, what we see here, is the tall cells, which are called as the columnar epithelium, and the flat cells, which is called as the squamous. So basically, we have this inside part in the cervix called as the endocervix, and the outside part called as the ectocervix. So what happens is these cells over a period of time keep changing in a woman's body. Like at birth, it has a different, kind of lining, and at just after puberty, it changes. And right before, the menstruation stops, or what we call as the menopause, it differs basically based on the age. So what happens is the cells, because of its nature of changing, the junction between these tall cells and the flat cells keep changing over time. So we have this original the new squamocolumnar junction and the old squamocolumnar junction. So basically, when after puberty, when the female just gets her puberty and the female hormones start increasing in her body, the junction goes up, and the original one that is just before puberty will be somewhere around here. So the zone between the original junction and the new junction is called as a transformation zone. So why is this zone important? Is because this is the site where the cancer of the cervix will develop. So what exactly is the causative agent, or what causes the cervical cancer? There's something called as a human papilloma virus. So this virus is the most common cause of cervical cancer. So what happens is this virus, when someone gets infected with this virus, the virus enters the cell, and the cells start multiplying and start becoming abnormal. So when a cell starts becoming abnormal, that is when cancer develops. So there are different strains of this virus and different cancers, or like different lesions or abnormalities the virus can cause. So what is this? We have this thing that the virus can only cause, cervical cancer or any other abnormal lesion just in women. But it's not like that. It can also cause lesions in the male. That is, it can cause warts or this oropharyngeal cancer, and many of these lesions. So it's not just the women, but also the men should be, aware and know about what's happening with this human papilloma virus. So the 16 and 18 virus causes carcinoma, which is the cervical carcinoma and the oropharyngeal carcinoma. The other strains will cause benign, or basically it's not a cancer, but it causes some abnormal growth of lesions. So if someone gets infected with this virus, what exactly happens? So basically, if a woman has sexual activity and she acquires this virus in her body, it's not like she'll develop the cancer just in a few days or a few months. It takes around 10 to 20 years for her to develop something called as the CIN, which is an basically it's called cervical intraepithelial neoplasia. It's not cancer, but the pre-stage of the cancer. So it takes around 10 to 20 years for her to develop this lesion. And then from then she needs another 20 to 30 years to develop carcinoma cervix. And it doesn't mean that whoever gets the virus gets the carcinoma. So it's only 10% of them who go into the CIN stage. And among that, only 10% of them develop the carcinoma cervix. So the best time to get screened or to get tested is when you have this lesion and it's detectable and you get a testing done, and only then you can prevent the carcinoma from happening by following certain measures. So after testing we have different grades of cellular variety and the report will give you the same. So what exactly is cervical cancer now? We got to know about the virus which causes it. So what cellular changes happens when the virus when we get infected with the virus. So basically cervical cancer is cells will change from normal to precancerous and then to the cancerous state. So it's due to abnormal growth, and the growth, because of the growth of these abnormal cells, they have the ability to invade and spread to other parts of the body. Again, based on what the depth of the growth is, or the length of the lesion is, we classify it into different stages, and it can spread to the surrounding lymph nodes or the surrounding organs, the vagina, the bladder, the intestine, and etc. So if at all one gets a cancer, what exactly can we do? So early stages, we can surgically remove it and no need of follow-up. When it's surgically removed, it's fine. The patient will have a better compliance and no need of further follow-up. But if it's in the later stages, they need to have continuous administration of chemo and radiotherapy. And yeah, sometimes if the severity of disease has increased so much that there's no other treatment, you have to just give palliative care or just treat the symptoms. So now, who is at risk of acquiring cervical cancer? So one, if a person starts sexual activity at a very young age, then smoking, multiple sexual partners, depressed immune system, for example, HIV, people with HIV or people with other comorbidities like diabetes, hypertension, family history of cervical cancer, long-term use of oral contraceptives, then having sexual intercourse with a person infected with the human papilloma virus. More prone age group is this age group from 35 to 55, low socioeconomic status, and impaired perineal hygiene or impaired vaginal health, basically. So how do we know that we're infected with this virus? The sad part is that most of them are asymptomatic. That is, they don't present with any of the symptoms. So it's better to always get screened even if you don't feel anything or you don't have any symptoms. But only few of them can present with abnormal vaginal bleeding or pain right after sexual intercourse, bleeding after menopause. Menopause is basically when the periods gets ended in a female around 45 to 50 years. Then heavy menstrual periods, unusual vaginal discharge, discomfort while urinating, pain in the lower abdomen or the pelvic pain, pain in the leg, weight loss, and constant fatigue or tiredness. What can we do about it? So we know the risk factors now, we know what are the symptoms, so what can be done about it? So one is to prevent the early age of sexual activity. We need to avoid early marriages, avoid early and frequent intercourse, strictly avoid monogamous relationships, and avoid smoking. Now, the most important part is how everyone should be aware about the screening procedure of cervical cancer, and the vaccination. So these two are the most important steps to be taken to eliminate cervical cancer completely from our country, because in other parts of the world they've taken screening very strictly, and this happens in a very regular manner. And yeah, so
अब क्या मान रहे आपका बिछा सौते दिन से मेरी मिक्सी बुला रही है ना
so the incidence of cervical cancer has reduced in the other parts of the world because of regular screening and vaccination, and that it's high time it has to happen in India. So again, improvement of genital hygiene and restriction of the number of children. So how to care? So wash your external organs regularly with unscented soap and water so that we can maintain our vaginal health. So changing of tampons or sanitary pads regularly to avoid vaginal infections. Practice of safe sex, so maintaining a healthy body weight and body mass index. Then changing undergarments every day and tracking our monthly cycle. Basically, we should see if we are regularly bleeding, and the number of days of flow and all should be monitored by each one of us. Regular exercise and stress management. Coming to the screening procedure, so as we know that most of the patients present with no symptoms, so how to detect cervical cancer or an intraepithelial lesion without symptoms? So everyone has to undergo screening procedures. So this can start from the age of 21, or at least before a person starts their sexual activity. So 21 to 30 years, cytological testing called as the pap smear is recommended every 3 years. So every 3 years, one has to undergo a pap smear test. Then between 30 to 65, either a pap smear test every 3 years, or there's something called as a HPV DNA testing, which can be done every 5 years. This is a more sensitive test, and it's specific to cervical cancer. And co-testing, that is, it's a combination of this DNA testing with this pap smear test. So either of these three can be undertaken, and more than 65, it's not recommended. So the age group between 25 to 65 years, all the women have to undergo a pap smear test once in every 3 years. What exactly is a pap smear test? So we get this kit called as a pap smear kit, which has this wooden a spatula, which is called as a spatula. So basically this goes through the cervix. So I showed you the anatomy of how a cervix looks like. So this goes through the cervix, and they just take a swab kind of thing, or a smear from that area, and that is sent to the lab. A smear is made and it's sent to the lab for further testing. I'll just show you a video of how exactly a pap smear test is done.
A pap test is a test to screen for cervical cancer or other cervical diseases. Your cervix is the lower part of the uterus at the top of your vagina. A pap test is used to check your cervix for abnormal cells. Abnormal cells can sometimes turn into cervical cancer if they aren't treated. A pap test can be part of a pelvic exam. First, your healthcare provider will place an instrument called a speculum into your vagina. A speculum will go so that your cervix can be seen. A lab like it usually takes about 30 weeks to get the test. Have questions about this test? Let's talk through.
Yeah, so that was how a pap smear test works. So basically, yeah, when the pap smear test is taken, so they give you a report of the lesions present, and they give a report as to what is the abnormality. Is it malignancy? Is it not malignancy? And then they give a report based on it. Why people don't undergo this cervical screening in India is, one is they are ignorant towards their own health, plus as I showed the video, a lot of people might not be comfortable with the procedure, And one second. Yeah. So a lot of people might not be comfortable with the procedure, and they might have some fear of surgical procedures or some family issues. So that's why we need to like overcome that, educate people, and then encourage everyone to undergo the screening. So now, after screening, we have vaccines for the HPV or the human papilloma virus. So what exactly are these vaccines? So we have three types of vaccines available, and these are not manufactured in India. These are from abroad, and these are very expensive vaccines. And this is one reason why a lot of people are, resistant to take vaccination. So one is the Cervarix, which has two strains, and because these two strains cause cervical cancer, only females can take it. And the Gardasil can be taken by both males and females because these two strains, which are 6 and 11, causes lesions even in the men. So both of them have to take it. Gardasil 9 has 9 strains, and this also can be taken by males and females. So currently in India, the vaccination is recommended only for female, but in other countries, they're giving vaccination, especially Gardasil 9 is being used in other countries for both males and females. What is the ideal age to take the vaccine? So, assuming that one would have started menstruating at the age of around 9 years, so the starting age group is around 9 to 14 years. And between this age group, you can take two doses, that is at the first visit and after 6 months. And between 14 to 45 years, females can take three doses, which is zero, first visit, second month, and 6 months. And more than 45 years, the vaccine is not recommended. So how this vaccine is given? It's given intramuscular, just like the COVID vaccine. And it has no side effects, maybe very rarely, maybe a swelling or little pain in the region of injection, but nothing else, zero side effects. So it can be safely given. But the only problem is right now, the Cervarix vaccine is around 3.5 to 4,000 rupees. And Gardasil is around 10,000 to 11,000 rupees. Because of this vaccine being very expensive, a lot of people are resistant to taking. So right now, we have something called as the Servavac, which is manufactured in India by the Serum Institute. And the cost of this is very less, and the government is planning to provide this for free and inculcate this in the vaccination schedule for children in the Indian Academy of Pediatrics. So hopefully in the coming years, Servavac will be introduced in the schedule and will be provided free of cost. But again, I would still recommend everyone, or at least below 45 years, take this vaccine immediately because of how we've seen how the incidence and prevalence is right now. So yeah, 3 injections over 6 months, 2 doses for 9 to 14, and 3 doses for more than 15 years. What are the contraindications? That is, who can't take the vaccination? Either you have allergy to previous doses, or the female is pregnant, or you have some febrile or very severe illness due to which you're unable to take the vaccine. So January is considered as Cervical Cancer Awareness Month. And yeah, so basically during January, especially in other countries, they carry campaigns about how everyone should be vaccinated, and how the screening procedures are also vigorously done there. So hopefully in the coming years, we have the same too here. Supporting the fighters, admiring the survivors, and honoring the taken. So thank you, guys. This was my session. Thank you.
Uh,
And
Thank you,
as
Pramata.
sorry. Yeah.
Thanks for the wonderful session. Dear participants, do you have any questions? You can type and ask, or you can unmute and ask. You can type directly to Madam Pramata and ask your questions. Okay. So, so believe there are no questions now. Pramata, if they have any questions, how they can rectify the questions or clarify the questions?
If you have any queries about where there's one question. Will there be any side effects of the vaccine? Like I said, the vaccine is given intramuscular. So if you remember how the COVID vaccine was given, in the same way this vaccine is given. So there are no side effects at all. That's why I told maybe very minimal swelling in the region of where the injection is given, or maybe little pain might be there. Apart from that, there's nothing else. You can ask me about maybe the vaccination or the screening procedure if you want to know how the screening procedure is done, because the video might be terrifying to look at, because but it's a very painless procedure, and a lot of women have been coming to the OPDs and clinics to get it done. So
Okay.
Ma'am, I have a question. You told pap smear is done for the screening, for the cervical screening. So why is HSD done, ma'am? Like, even that also, depicts the cervical cancer, or any other procedure is included?
you're talking about HSG, no?
Yes, ma'am.
Hysterosalpingography.
Yes.
Okay, so that is, see, histero means uterus. So
Okay.
that is mainly for any maybe a polyp. There's something called as an endometrial polyp or
Yes.
something. Yeah, so maybe an endometrial or a uterine lesion is seen on HSG, but not the cervix. See, when we put a speculum, you saw the video, right? So when we put a speculum and visualize it, cervix is easily visible, but the uterus is not. So HSG is done for uterine lesions.
Okay.
Okay. Any more questions? Okay. Pramada, if they want to contact you, or if they want to clarify anything, so how can they contact you or the nearest doctor kind of?
Uh, okay, if they want to personally ask me about anything, I can give my contact number. Otherwise, if
Yes.
it's about screening or any vaccination, screening is done in the nearest, maybe any government hospital, any private practice will have a screening. So that is there. And HPV vaccination right now is only available in private hospitals. So right now government doesn't have it. So maybe they can go to private hospitals, and then, like I said, it's a little expensive right now. So yeah, they can go to any private hospital for the vaccine, but screening is done everywhere. Government, it needs very minimal instruments, very minimal setting. So any even campaigns from the government, there are a lot of pap smear campaigns happening. So free of cost, it can be done, the screening.
Okay. You can share your number and the email ID in the chat box.
Okay. I've shared my email ID. I think there's one more question. Why vaccination is not recommended above 45? Okay, so what happens is vaccination is only for prevention. It's not the cure. So, like I showed you the timelines of how the virus enters, and then it takes 10 to 20 years for the CIN to happen, and then again 10 to 20 years for the cancer to happen. So, by the age 45, if at all the person had to be infected, they would have already gotten infected. So, there is no point of a vaccine. So, that is why we don't recommend it after 45 years. So even if they would have developed CIN, they would have already developed, and there is no point of giving the vaccine to them after, like when they are 45 years. So that is why we don't recommend it.
Yes. Okay. Thank you, Pramata. Now I request we come to the end of the session now. So, dear participants, I have shared a Google form link. Kindly fill in the Google form link, and you can get your e-certificates of the session. Now I request Fatima to give the word of thanks. Over to you, Fatima.
It's Siman Fatima, sir.
Am I audible, sir?
Yes, Ma, you are audible.
Yes. Good evening, everyone. I extend my heartfelt gratitude to each one of you for your active participation in today's session on cervical cancer awareness. Your presence here reflects a shared commitment to promoting women's health. I especially thank to our distinguished speakers who enlightened us with their valuable insights and expertise. And I also would like to thank you, Disciple India, for Learning Forum for giving this opportunity and sharing us also inspiring us to take proactive steps in raising awareness. I would also like to express appreciation to one of our to the all sponsors for their generous support, enabling us to organize this event. Your commitment to promoting health initiatives is commendable. And at the last, let us carry forward the knowledge gained today and actively engage in spreading awareness about cervical cancer prevention and early detection. Together, we can make a positive impact on women's health. Once again, I thank you all for being the part of this important initiative. Your involvement is crucial in creating a healthier and more informed community. Thank you all. Over to you, Misbah.
Um, that was a knowledge-full of session, ma'am. The impact of your words will undoubtedly resonate with our participants, and we are truly grateful for taking the time to share your expertise and insights with us. Thank you so much.
Thank you. Thank you so much.
Thank you. Thank you all. Have a great weekend and a good night.
Thank you, sir. Wish you the same.